Welcome to McKenney Chiropractic's Weekly Buzz. I'd like to welcome you all here this week. Today we're going to go over a topic, decompression therapy, something that's going to help out with a lot of disc herniations, sciatica, and lots of other problems, even such as carpal tunnel syndrome. So at this point I'm going to start off by talking about the different types of disc herniations. There's three different types of disc problems that may arise. Number one being a disc bulge, number two a disc rupture, and number three a sequester of the disc. Now, depending on the type of disc problem you may have or the severity of your problem depends on whether you're a candidate for this type of therapy. At this point, let's go ahead and take a look at how this may affect your spine or how these types of problems may arise. This right here is a model of the spine. Now, you're looking at it from the side. Now, it's important to know that there's three curves in the spine. There's one with the cervical spine, one with the thoracic spine, and one with the lumbar spine. Now, these three curves work together. They protect these nerves which come out of a hole called the neuroforamen, and they also protect the vertebral end plates. Now, as you can see, these three curves work together also like a spring. And if we're missing a curve in a certain area of the spine, say we're getting a straightening of the cervical curve, this adds added pressure to this area, which will give you disc damage, and it'll also start affecting this nerve, giving you what you feel. This is just a model of some of the types of problems that may arise with people with different types of disc problems. If we're looking up here in the neck here, as you can see, some patients will start to get the pain down the arms. And then if we move on to the lower back, patients will get the pain down the legs. These types of problems typically arise from different changes in the curvature of the spine, as well as different types of degenerative problems and sometimes significant trauma. Essentially what we have here is a cutout of the lumbar spine. Here are two vertebrae, and this is the disc that we're talking about that has the problem. Now, what our goal is to do in decompression is we want to start tractioning the spine here. And we pull apart the spine. This allows for the fluid which comes out of during a disc bulge, disc herniation, or disc sequester to allow to flow back in. Let me show you what that fluid is that we're talking about. And this is where we get our pain. You see how the nerve is right over here, and you see the slit right there. Now when I press down right here, that's when we have our disc problem. The ooze is coming out, puts pressure on the nerve, giving us some of the symptoms of pain down the leg, pain down the arms, those types of problems. And when we start to traction the spine during the spinal decompression, as you saw before, we start to pull apart and traction the spine, which allows for that fluid to seep back inside, thus relieving nerve pressure. Welcome to the therapy department. This is Carol. She's our therapist. She's the one that does our spinal decompressions in the therapy department. Today she's going to demonstrate a lumbar decompression therapy of the spine. Now I'm going to go over what we're trying to accomplish here with the decompression therapy. As you can see, when we come through here, we've got a nice pull right here, and it's very important with the angle of what we're getting to pull, because that's going to affect the special disc that is having the problem. We'll also have the spine stabilized at this point, all right? And this allows for the traction of the vertebrae, which allows for the fluid to go back into the disc. Spinal decompression has helped change many people's lives. Many of them have been spared from going through spinal surgery. The only thing that I ask is that you go through and explore all options of decompression before making your choice which is right for you. Also, remember that this week is Patient Appreciation Week. We're going to be doing lots of things in the office today. We're having, and all through the week, we're having the appetizers and refreshments. So please stop by. We're having a lot of things this week. Remember, we're also doing the drawing for the 1 hour massage. I love McKenney Chiropractic because. Check that out on Facebook, and we'll be doing the drawing live on our next week's Weekly Buzz. So be sure to tune in. Have a great day.